Economic disparity is exacerbating the pandemic. The American Heart Association is spending $2.5 million on rapid research to discover what can be done for people who have underlying heart diseases in the African American and Hispanic communities and are suffering because of COVID-19. But that's not all. Dr. Regina Benjamin, the 18th Surgeon General of the United States, joins us now. An honor to have you here, and there's an emphasis on rural America. What can you tell us?
We know that your zip code is a better predictor of your health outcomes than your genetic code. And so it's not just in minority communities. We have the same kind of problems here in our rural communities with high blood pressure, obesity, diabetes, things that lead to coronary artery disease or cardiovascular disease. And so we're going to start seeing some of these same type of numbers and frequencies in our rural communities that we're seeing in the minority communities. So it's everyone. And these are the everyday people going to work, holding down the jobs. What we're talking about is our essential workers, the people who are doing the things that we need to be done every day. These are the people that are at risk. And yet they can't do some of the things that we ask them to do, like social distancing, because they have to go to work and keep those essential services going.
What are some ways that people can protect themselves?
So we want to make sure that people are aware and that they can do the things that may be simple, but things that can have potentially save their lives. Things like social distancing, basically washing your hands, wash your hands, wash your hands. Things like eating healthy, exercising. Even though we're socially distancing, we can find creative and fun ways to exercise, put on our old record, play, have fun, make it enjoyable. If you're having issues with mental health or behavioral issues, try to seek help. Call a friend. If a friend doesn't answer, call another friend. Don't try to go it alone. There are things like don't smoke, certainly don't vape. Those things can at least give your body a chance to be resilient and fight off any kind of infection, including coronavirus.
Tell us more about how this also becomes an economic problem.
It's a problem for the economy because it's the basic backbone of our economy, our basic workers, our everyday Americans who are going to work, trying to keep that economy going. Most of us are shut down now, but there's some people who can't shut down because they're essential workers. They're trying to keep the economy going as much as possible, stocking in our grocery stores, working in our transit systems, our policemen, our hospital workers, all of the people that we depend on every day are having to go to work, but many of them will have these underlying cardiovascular diseases, prediabetes, high blood pressure. Those things exist, and yet they're at risk.
Thank you for being on our show. We do appreciate your time today.
Wish everyone the best of luck, and we're all out here trying to make a big difference. And if you want more information, particularly around cardiovascular disease, some fun things to do to exercise while you're at home, the American Heart Association has a website, heart.org.
For more Business First AM, check us out on social media. We're on Facebook, YouTube, and Twitter. And go to businessfirstam.com for where to see our show on TV.